Right now, we're joined by U.S. Senator Bill Cassidy, Dr. Bill Cassidy as well. Good morning, sir.
Hey, Tommy, how are you, brother?
I'm well, and you?
I am great.
We just spent some time with James Carroll, the drug czar, and I want to get your take on this because you're, obviously a physician. Is it all about? I mean, it's got to be a two-pronged approach, right? Or maybe multi-pronged. You got to keep it out of the country. And he spoke about China and the efforts with the administration, et cetera. It also goes to border security, does it not?
It goes to. It is multi-pronged. Keep it. It's coming through the mail. It's coming across the southern border. There's a financing aspect of it that I've been going after. How do you get the dollars, the millions of dollars you get from selling the drugs out of the country? If you can interrupt the financing, then they can't afford to bring it back in.
Well, wait, let's drill down on it a little bit, Senator, if we can. How is it working, and how do you stop the financing part of it?
Yeah, so I am, it's called trade-based money laundering. And with trade-based money laundering, you may have somebody billing for goods being shipped, but the goods are never shipped, but the money still moves. And so you have a fake invoice, a real invoice with a fake manifest, or else it's going to be a double invoice, or it's going to be I mentioned a phantom invoice,
right,
or an overpriced invoice. All that is part of it. And so we're trying to come up with a way in which you can connect the invoice with the manifest and to eliminate the double and phantom invoices that allow hundreds of millions of dollars to move across the border.
How would you begin to investigate that?
So now we're going to get a little wonky.
Well, I don't mean, the devil's in the details. I think there are a lot of people that are kind of wonky and care about how you do it.
So if you think about Bitcoin is part of what is called a distributed ledger. There's a way to take that same sort of technology and put it in so that when a company is trading goods, you actually have what is called a chain of truth, a distributed ledger in which there is a link placed in this chain. This is the manifest. Now, think of it this way. I'm in New Orleans shipping goods to Guatemala. The manifest is going to Guatemala, but the invoice goes through Panama. In Panama, it's marked down 50%. And so Guatemala does not get the amount of revenue that it should because it only gets duties on half of what it should be. If you had this kind of public distributed ledger, officials in the United States, Panama, and Guatemala would simultaneously be looking at it, and if it was marked down, they would know it. Now, this is one example of how this can be used to root out corruption and to give governments their appropriate amount of money, but to stop criminals from doing bad things.
And for people that think it's easy to stop this, that gives you an explanation, and that's just one example. Dr. Bill Cassidy, our guest, U.S. Senator. We're going to take the break a little bit early here. Senator, I want to give you some time when we come back. Talk about your efforts as it relates to paid family leave and surprise medical bills. A couple of big problems we're facing in this country. Back in a flash, 8:49. Traffic now, WWL. Senator Dr. Bill Cassidy spending some time with us. We've already addressed the opioid crisis, drug crisis in the country. Let's talk about paid family leave.
Yeah, paid family leave. Ivanka Trump is making this a big issue, and if Ivanka Trump's into it, the president is as well.
You would think.
I have the privilege of working closely with them. If you look at folks making $70,000 or more, they typically have paid time off to take care of their baby when the baby's born. $70,000 and less, not so much. And there's a perspective of the small employer trying to make margins. They can't really afford to pay for that. Mm-hmm. So we're coming up with a policy that would allow, without raising taxes, give some sort of payment for someone who takes time off after her baby is born. We know it's good for the baby to breastfeed. We know it's good for the mama to stay home and recover. We also put the dad in there so the dad can help as well. For the employer, instead of losing an employee that the employer has invested 3 years training to be a better employee, but she now wants to stay home with her baby, maybe going on public assistance because she otherwise has no income, we allow that attachment to employment to continue and the mama to come back to work after she spends time off with her child. So we think it works for the employer, the employee, the mama, the baby, the daddy.
Wait, so from the employer standpoint, Senator, I'm sorry, what do they do while this person's out?
So it's going to be the same situation that they would have if the employee just quit. They're going to have to find a replacement. But instead of a permanent replacement whom they have to retrain, at least they have an employee who's going to be coming back. And by the way, it could be that they were just taking FML, the non-paid family leave that's currently eligible. So we think the situation for the employer is better because, one, the employee is probably going to be out anyway, but at least at this point they're going to come back and bring back with them that training that they have received from their employer.
And who's making up the lost income?
So we have a financing mechanism that we'll be kind of unveiling, but you
can tell us now.
Well, I have to make sure that all my Democrats are on board.
I know, I'm just playing. But anyway, it's so financing mechanism?
Yeah, financing mechanism. Some people like Marco Rubio, have discussed borrowing against future Social Security income. I don't like that so much. So we have another mechanism, again, without raising taxes, that we think that we can maybe go through the Social Security system, and which will be a temporary form of disability, if you will.
Tell me about surprise medical bills. What's going on with that?
Oh, my gosh. Everybody, Tommy, probably you, certainly me. We've gone to a doc. We thought and I'm a doctor. Yeah. We thought everything was in network, but you may get an out-of-network bill for a piece of equipment.
Or maybe even for a doctor you didn't even know you saw.
Totally.
Right.
So we're putting in a mechanism by which the doc gets paid, but the patient only has to pay their in-network charges. If the insurance company and the hospital don't like it, they can duke it out with each other, but the patient's taken out of the middle, and that's what we're shooting for.
And what kind of support do you have for that?
Tremendous. We got 20 different Republicans 20 different members of the Senate, 10 Republicans, 10 Democrats who are signing on as co-sponsors of the bill. The president will sign it. We think we can get it through the Senate and the House. There's always a chance it gets messed up, but we think we can get this through. I got a
texter question here, if we can get to it real quick. And it just says, ask Senator Kennedy, what do we tell doctors who are nervous and afraid to write prescriptions to patients who have terrible pain? And, of course, on the other side of that, we got a doctor that pled guilty from the North Shore federal court yesterday for running a pill mill. How do you balance all of that?
Yeah, so I assume the question is for Senator Cassidy, not Kennedy. But
did I say Kennedy? Let me tell you why I said that. Because Senator Kennedy was with us for an hour, and before you left, I was going to ask you to come sit in with us for an hour one morning whenever your schedule allowed it. So that's why I slipped and said Senator Kennedy. So I got that out of the way now. Let's address the question that I posed for Senator Cassidy.
So there's a couple of issues here. One, how do you appropriately manage people with chronic pain? There's been a report, I think it was released yesterday, if not today, by a task force on the management of chronic pain. And it's going to be through the Department of Health and Human Services, HHS. You can Google it. It's a very good document with all the stakeholders involved, including patients with chronic pain, but also physicians, pain docs, et cetera, of that management. And we're going to have new guidelines coming out that will give guidance as to how people with chronic pain should be managed, not just cut off on opioids if they should receive it. On the other hand, if you go in with a sprained ankle, you shouldn't be given 90 days of an opioid. And certainly, unlike that doc on the North Shore, you shouldn't be writing pills for people you don't see. So I think we're getting to where we need to be in the management of both acute and chronic pain.
Not only writing pills for people you didn't see, but having Medicare pay for it, or Medicaid. Senator, again, I'm sorry that the listener mistook you for Senator Kennedy, but maybe they were thinking about your coming on as well. And we do extend the invitation, and we would love to have you in studio for an hour if you can ever find it within your schedule.
We'd love to.
Thank you, sir. You have a good weekend.
You too. Bye-bye.
U.S. Senator Bill Cassidy.